Yes, there we go. Okay, so welcome everyone to our special Neck Cancer Day patient stories. I'm really grateful to our two ladies who agreed to share their stories today. And I will pass you over to Rachel for the introduction. Thank you, Rachel.
Yes, thank you everyone for tuning in, and a special thank you to our two speakers today. We have two very special people to me and patients of neuroendocrine cancer that are going to be talking today. And so we're going to do a little bit differently this year. We're going to do an interview style for this Net Chatter event. So I'm going to introduce our speakers, and then I have a series of questions that I'm going to ask and allow both of them to answer. So the first person that I would like to introduce is Miss Shane Callans from Birmingham, Alabama. Shane is 50 years old, and she is a mom of two, and she teaches 4th grade, and she recently celebrated 29 years of marriage and teaching. And our second speaker is Dr. Kimberley Baker, and she is a PhD and associate professor of biology at the University of Indianapolis. She is a molecular geneticist by training and published research articles on the transcriptional regulation of oncogenes and tumor suppressor genes involved in the development and progression of breast cancer. As a Public Voices Fellow with the OptEd project, she has written about the challenges that she has faced advocating for her healthcare as a neuroendocrine tumor patient. So I'm very lucky to have both of these ladies here today to speak. And so I'm going to go ahead and start off with a question for Shane and Kim. So Shane, I'm going to ask the question if you'll answer first, and then Kim, if you'll follow in second. So the first question that I have for you both is, when were you first diagnosed, and what is your specific neuroendocrine tumor diagnosis?
So I was first diagnosed in 2002 in August, and mine was a pheochromocytoma.
Kim?
So I am a more recent NET patient. I was diagnosed last year in 2022, and I have neuroendocrine tumors originating in the small intestine. But at the time that it was discovered, unfortunately, it had already metastasized to the liver, which we know is common for a lot of NET patients. And
yeah. So, yeah, go ahead, Kim.
Oh, sorry. I was just going to elaborate. I think, like most people, how you're diagnosed differs. So I initially actually had pains like my upper right quadrant, and I thought it was going to be gallstones. And I made an appointment with my primary care physician, who also, based on my symptoms, thought it was gallstones. I had really no other symptoms, had been healthy up until that point. And well, I won't go on. It was a long conversation, but eventually by the end of that conversation, it happened to be a Friday, and they were trying to send me to the emergency room for further testing, and that's not what I wanted. So ultimately, we were able to get a CT scan that same afternoon. So still thinking it's gallstones, but they were going to rule out just in case it was nothing more serious. And a few hours later, I get a phone call from a new primary care physician that I didn't actually have a relationship with. This was just somebody who was able to see me based on my symptoms. And she ended up saying, well, there's no easy way to say this, so I'm just going to tell you. There's lesions on your liver indicating metastasis, and it looks like there might be a mass in your intestine. And then that's kind of all she said. And okay, we're going to send you for further testing. And as probably most patients, when they get their diagnosis, the wind was definitely knocked out of me, because you're thinking it's something completely different. And I was floored to think, how could I have stage 4 cancer and it be this far and not have had any symptoms whatsoever up to this point? And at that time, we didn't know what kind of cancer it was. I asked her what she suspected, and because she was a primary care physician, she was hesitant to say anything and just said, we're going to refer you to another specialist, and we'll do a liver biopsy, and once they do that, they'll let you know. And that's kind of how I found out. And I turned to my husband and I was like, this is not good, because in my mind, since it was already in the liver, I was expecting or anticipating that it was a more aggressive cancer and thinking that I had maybe a matter of months to live if I was lucky. And so it was a really short conversation, and then you're kind of left hanging.
So that brings up a good point. Shane, how old were you when you were diagnosed, and did you have any symptoms leading up to your diagnosis?
I was diagnosed when I was 29, but I'm pretty sure I had it at least when I was 26, probably earlier than that. Um, and unlike Kim, I didn't have any pain, and I was searching for something that was wrong. I had been to several doctors because I was sweating and couldn't figure out why I was sweating. Just all of a sudden, it could be February, really cold, have a jacket on, and just pouring sweat. And I had my first daughter right after I turned 26, and all of a sudden just started sweating, couldn't figure out what was wrong. Went back to my OBGYN, and she said, it could be that your body temperature has just changed. She checked for hormone levels. Everything was normal. She said, I'm going to send you to an endocrinologist. We'll see. We'll test your thyroid. Maybe it's your thyroid. So I had first spoken to my regular doctor, and he had no clue. He said, just check with your OBGYN since you just had a baby. So I went to an endocrinologist. They checked the thyroid levels. Everything was normal. And my only symptom at that point was sweating. And so, I waited. So I waited almost 3 years, enduring sweating, couldn't figure out what was going on. And my second pregnancy with my son, when I got pregnant, the sweating stopped. And so I thought, well, maybe she was right. Maybe my OBGYN was right. My body temperature just changed and it stopped. And maybe it was hormones and they didn't see it. So after I was in labor with him, during labor, my blood pressure shot up, and that was uncommon. They didn't know what was going on. And so after that, the sweating came back and my blood pressure was just elevated a little bit. Usually it was 120/80. It stayed about 140. And so I went to a different endocrinologist. My stepmom is in pharmaceutical company and was, calling on lots of endocrinologists. And she said, why don't you go see this endocrinologist? And I said, I've already seen one. I don't need to see another. They tested everything. She said, different doctors are different. They have different knowledge. You need to go see a different endocrinologist. So I went to go see this doctor. And as soon as I went in and told him I've been sweating for 3 years, and he said, stop. There's only 4 things that cause sweating, this, and this, and this. We're going to test it. What other symptoms do you have? And I was like, well, I don't think I have anything else. I said, my blood pressure is up a little bit. We're going to test for this. So he knew what to look for. He did a 24-hour urine culture, the test, and tested the norepinephrine, the epinephrine levels. And it came back that mine was like 14 times higher than normal. And he said, you've got, what did he say? He said, I think you have a paraganglioma or a pheochromocytoma. He said, pretty sure it's there. We're going to run some tests and see. And at that point, unlike Kim, I'm relieved at that point that I'm not crazy, because I've been sweating for 3 years and I'm like, something's wrong with me. And so I'm just thinking, okay, I have a tumor. I'm going to get it out. And so he ran some tests. He did a CT scan. They didn't find anything. And he's looking in the adrenal glands because that's where he's thinking it should be. And we did another CT scan that was just a little bit finer depth and said, we think we see something behind the stomach. And then did an MRI and finally found it. And so, at that point, that's kind of where it took off. So it's a lot of searching for a long time.
Yes. Wow. You guys, very different stories. And yeah, like Selena mentioned, no 2 zebra stripes are the same. So my next question for you guys is, when you were first diagnosed, had either of you ever heard of neuroendocrine cancer before, or neuroendocrine tumors? And where did you get information when you were diagnosed to learn more about it? Shane, I'll let you start.
Yeah, I had never heard of neuroendocrine tumors nor paraganglioma, pheochromocytoma, except when I was sweating. My dad used to run a lab, and he said, he had searched, and he said, there's something that could be causing it. And he had mentioned pheochromocytoma. And I was like, I have no clue what that is. I said, I seriously doubt that's what it is. I mean, I'm just sweating. I don't think so. And so that was the first time I'd heard it. And then when I went to the doctor 3 years later and they did find that, I said, wow, he was right. But the only information I really found was through the internet. So, the one endocrinologist had knowledge of that, but not many other people had, because even if I spoke to another one, they were like, I've heard of that, but I'm not really sure what that is. So it was hard to find information on it.
So, given my background, I know I'm not the perhaps average patient. I teach at a primarily undergraduate institution, and I actually do teach a class in cancer biology, and I use a lot of case studies. So I had vaguely heard of this because I actually had a case study on multiple neuroendocrine neoplasia due to a mutation in a particular gene. So I was familiar with the, lab scientist side of it, but honestly, I didn't really know that much about it when they told me what it was. And, in terms of when I finally got the official diagnosis a few weeks later, it was also just very jarring as how it was delivered. It was a nurse who told me, you have a metastatic, well-differentiated type 1 neuroendocrine tumor. Any questions? Have a nice day. And I was like, is this really how they're delivering information? So this was somebody who was not even, going to give me any additional information, just tells me what it is. So I'm left to my own devices to, start Googling things. I was not that knowledgeable about it. And so I chose, again, I realize I'm maybe more unique because my academic background, I turned into research mode and I put on the scientist hat. And so I turned to the databases and started looking at the actual primary literature, what are physicians looking at? I tried to Google and search for different organizations that might have patient information, because I was literally given zero resources. And even after I saw the first oncologist who talked a little bit more in generalities about my type of cancer, gave me zero resources, not a brochure, not a here's where you can find more information, just this is what you have and we're going to do further testing and we'll get back to you. So I did all that I could to try to educate myself, because I think everybody will say, all the support groups, knowledge is power. And the more you can know and understand about your unique situation, and you don't have to be an expert, just the more that you can learn about your own diagnosis, you can be more informed when it comes to making decisions. So I like to think I'm an outlier, but as Shane mentioned, a lot of physicians, this is rare, and that's why we're talking about being zebras, that the average even oncologist hasn't seen many patients with this type of cancer. And so they're not as knowledgeable perhaps as a center who sees hundreds of patients a year.
Yeah, absolutely. Absolutely. So my next question for you guys is, what treatments have you received? And I have a couple sub questions, but I'm just going to leave it at that. If you could talk about any treatments or surgery that you've received so far. Shane.
So I had surgery about 3 months after I was diagnosed. So in 2002, I had surgery and had to take a beta blocker before, because it was a pheochromocytoma and it was secreting hormones. So I didn't realize actually how bad it was going to be until like right before the surgery. I was just excited that it was finally going to be removed and I would stop sweating. So when I took the beta blocker, I had some side effects. So I had to find one that actually worked that would take, so that when they did the surgery, that the pheochromocytoma would not shoot up my blood pressure. But I had surgery and was in ICU for a week, because it was it was a big surgery, and I didn't realize. I knew it was going to be a big surgery, but I didn't realize how big it was going to be. But I was very relieved. So after it was done, I think it took me about 3 weeks for my blood pressure to normalize, because it had been elevated and it dropped well below. I was dizzy for probably about 3 weeks. Just blood pressure, probably 90 over 65, which I was not normal. That was not normal for me anyway. So, anyway, after that, everything was fine, just recovering from surgery. It was a little bit, but I haven't had to endure any other treatments. Surgery took care of it and it has not come back. So that's been quite a relief. So, but finding a doctor to do the surgery was a challenge. So, because even at UAB where I was, I thought, surely somebody's done this. And it had to be a doctor who was familiar with, and it was right at the end of the stomach, or behind the stomach. So it had to be somebody that was like a gastrointestinal doctor. And finding someone who had actually removed one, my question to him was, have you seen this before? Have you removed it before? He had removed 2 in his lifetime. And so I was like, okay, well, that's better than me talking to some other ones who have never removed it and they haven't seen it. So it was successful. So
That's great news. That's why I'm smiling.
yeah.
So in my situation, I elected to have surgery 6 months after my diagnosis. I also sought a second opinion because the first facility and group of physicians that I saw wanted to watch and wait because they said I was asymptomatic. Although I did have lots of pain, but I guess that didn't count as a symptom because I think they were focusing on most people with gastrointestinal nets have carcinoid, syndromes, and that they're, having diarrhea and flushing and a lot of things. And I didn't have that. So in their mind, there was no need to act. I wasn't satisfied with that answer because I knew the primary tumor could still just keep metastasizing because in my case, it was already in the liver. And I did choose to speak to a physician or a surgeon, at the first facility. And he indicated that I could elect to have the primary tumor removed, but that they wouldn't touch the liver. He said there were other treatments for the liver and that, it was inoperable. He didn't necessarily say that directly to that matter, but the fact was they were not going to touch the liver. And like most patients, you're trying to navigate the journey on multiple levels with insurance. Do I deal with the logistics of trying to travel out of state? So I did seek a second opinion at a specialist center that actually had an entire multidisciplinary team specializing in NETs. And so this surgeon that I elected to have do my surgery, he only does surgery on NET patients. And so he had seen hundreds and hundreds of patients. So again, 6 months after my diagnosis, I had surgery, and yeah, it was a major surgery, and definitely I was in the hospital for 10 days as well. Not in the ICU, a little bit different, because I have a different tumor, not secreting the same hormones. But nonetheless, I ended up having a small bowel resection. They found that there were actually 2 primary tumors. So they removed the small bowel in 2 different sections and then put it together. And then because it was at the junction of where it joins the colon, my right colon was also removed. In addition to, 26 lymph nodes. I had some mesenteric masses. And then this surgeon did do surgery on the liver. I had a combination of wedge resection, so removing certain sections surgically, And then he also did microwave ablations. It was actually another specialist that worked with him. It was a liver specialist. And so I think they removed like, I don't know, 32 tumors from my liver. I was amazed that they could actually do that. Yeah. And again, no symptoms up until the pain. So you can imagine, I was like, how can I have this much tumor burden in my liver and I'm still relatively healthy? And if anything, I was in awe of the science. I was like, this is pretty amazing that your body can still function and be relatively healthy. So yeah, boy, that surgery. I do have 3 children. I'm a mom as well. Sorry, I should have mentioned that in my biography, and I've been married for over 25 years. And I will say this surgery was much more challenging than natural childbirth.
Yeah.
I was not prepared for the level of pain afterwards, to not be able to get out of bed. And I struggled, I couldn't eat. And I think for me, part of the problem that had happened before my surgery, they recommended going on lanreotide, which is a somatostatin analog. And apparently I was one of the unlucky few that had lots of side effects. So I had a lanreotide injection, the slow release, and it made me really nauseous and I couldn't eat. So actually, like a month and a half before surgery, I drastically lost like 12 pounds. I was living on like white bread and rice. That's about all I could stomach. And so I was just really weak, and I think my stomach shrank. And then in the hospital, they originally thought I'd be there 5 days, but I couldn't eat. I would literally take one bite of food and I was nauseous and full. And but anyway, eventually I made it through that. And so I recovered, I would say by 6 weeks, I was back to myself. They really encouraged me to be modal. So at first I could do all I could to get from the bed to the bathroom in the hospital, shuffling. But by about 6 weeks, I was back to running again. So I just tried to keep moving slow but sure. And I don't mean to monopolize the conversation, so I can stop. But unfortunately for me, I still have more tumors. So my journey is not going to be over. So there will be next steps.
Yeah, so that was really, leading into my next question for both of you guys was, to talk about any current side effects that, you may be experiencing. And then if you have any future plans for treatments or surgeries, kind of what's the state right now that you're in? Shane, I'll let you start.
So I don't have any more NET tumors, thank goodness. I did go back to my endocrinologist, the one who originally found it, about 2 years ago, because I started having some hot flashes and wasn't quite sure if that was sweating from the tumor or, that was hot flashes. So I just went back to him and I said, I just need you to run some tests, make sure everything's okay. And he did. He said, you're fine. He said, there's no reason to be worried. So I've not had anything else. So
Shane, you're not on lanreotide or octreotide or anything like that? Okay, I was just curious.
No, I only had the surgery, and after that I have not had any other treatments or any other symptoms. So very fortunate.
Okay, wonderful. And Kim, I know you kind of touched on it. Was there anything you wanted to add about kind of currently how you're feeling with side effects, or the horizon of your treatment?
Sure. So the physician I'm seeing, he is a big believer in scans, MRI scans, every 3 to 4 months, just to kind of keep on top of things and surveil. So my surgery was just this past December. So I did have a scan about 3 months afterwards. And the MRI showed that I had about 3 residual lesions. So it was the original tumor burden. And I mean, I'll be honest, I was somewhat disappointed. You always hope you're going to be the fortunate one to be one of the patients with no evidence of disease. And so again, I was initially disappointed to know that there were still three left behind, but I focused on the positive. I think as a NET patient, you're constantly recalibrating, if anybody has residual disease, you're constantly recalibrating mentally how to deal with things. So I got over the disappointment of, okay, there's still a few tumors there, but we've really reset the clock. That's a phrase that's used a lot in this field, that I knew going into surgery for me, it wasn't going to be a cure. but instead rather it was to try to kind of turn back time and allow my maximum, I guess, outcome of benefit in terms of lifespan, hoping that the tumors would grow slowly and maybe it would take another decade before we're at a point where, you know, things might be back where I originated. So then about 3 months after that, I had my second scan, and lo and behold, this one was even more disappointing. The MRI revealed that I actually have more than 10 sub-centimeter lesions in my liver. And, you know, so much for slow growing. That's hard to explain to other people too. I'm like, well, it's slow growing compared to other types of cancer, but and then I was like, how did this, you know, in my own mind, I'm like, wait a minute, 3 months ago I had 3. Now how do I have all of a sudden a lot? And I knew that there was, you know, the great likelihood that tumors were going to develop because mine had already metastasized, and I knew there was undetected disease burden. But then it turns out additional variables with the healthcare system, they use the wrong contrast. So anybody who's had MRI scans of the liver might be familiar that Eovist is the preferred contrast or enhancing agent to look for liver metastasis. And there's a standard contrast used for other types of MRIs. And it turns out at the 3-month scan, they used the wrong contrast. So then it probably was likely that those tumors were there, but they were just missed on the first scan. And then this brings me back to, you just constantly have to be your own advocate. I will share that for me, unfortunately, when I went in for my scan, I asked, okay, are you sure this is Eovist? It has to be the liver specific contrast. And the techs that were helping prepare me were condescending and almost rolling their eyes. Like, of course we're using the right contrast. How dare you question us? And guess what? They used the wrong contrast. So now I am going to literally ask them to show me the vial before they do the injection, because it was a wasted scan. So on many levels, my physician can't use the scan because we're comparing apples and oranges. You're going through all that mental anxiety of getting your scan, and then it's money, it's time. Again, at this point, my physician said, and I'm seeing my surgeon actually, and he's been wonderful. I feel like he shows me the scans. So even somebody who's not a radiologist, when I compared the 2 scans, you could see that the difference in contrast, it was striking. You could see that the images were grainy when they used the wrong contrast. So I don't know whether that made me feel better or worse, knowing that, okay, there's still more than 10 there, but maybe, you know, they were always there, not necessarily new. Because I had such a bad reaction to the lanreotide, my surgeon has advised watch and wait. We'll see how fast they grow, because it is about quality of life. If you're sick on the injections, maybe they aren't going to grow any faster by not being on the treatment. So my next scan is next week. Scanxiety is real, so that's increasing. In the event that they do start growing, then I'm going to try octreotide to see if perhaps my body will respond more favorably to that. And for me, the journey will be, and Shane, I'm so happy for you, so I'm sorry if I'm the kind of a downer here, but
No.
my disease will be lifelong, and so there will be further surgeries or interventions down the road. Most likely interventional radiology, things of that nature. So I guess I just keep taking it scan to scan in 4-month increments.
Kim, will you spell the contrast? You said Eovist?
Yes, EVOIST.
Okay.
But again, that's for looking specifically for
the liver.
I'm not an expert. This is, you know, I'm using what my physician has told me, but I know it's a specific contrast that's taken up by cells in the liver to really allow them to visualize metastasis compared to the standard contrast. And again, as a non-trained individual, we pulled up images side by side. I appreciated that he showed me, and he even measured how big the lesions were. It was striking. I mean, you could clearly see it. Like, you know, anybody, a child could look and be like, okay, I see something on that one, but not on the other one. Right. So it matters.
Yeah.
Josh was wondering if you knew the name of the incorrect contrast agent that they ended up using.
I think the standard is Gadovist. So it's GADOVIST. So again, I think for most MRIs, again, I'm not a physician, that's sufficient contrast. But I know for liver metastasis, they do like delayed phase. So you're kind of in the MRI machine for a long time, and they wait for the cells to take it up, and then it releases it. So they capture it at multiple points. And so in order for that to work, you need Eovist as your contrast agent.
Wonderful. Thank you. Okay, so now we're going to kind of dive into a couple deeper questions. And then at the end, I do have some specific questions for each of our speakers. But so my next question is, what has been the most difficult aspect of being a patient with neuroendocrine cancer for you? What was the most difficult aspect thus far? And what have you done, or what are you doing to help overcome and get through that most difficult aspect? Shane.
So I would say for me, it was actually trying to find out what was wrong with me because of the sweating for so long. And during that for 3 years, it was just, that was the biggest struggle, was just what's wrong. And not having enough doctors know what to even check for. I don't know. And I think, just knowing when you go to a doctor, you're expecting them to have some clue or send you somewhere that, a specialist. And I think just with them not having the knowledge was a real struggle. That was my biggest struggle. And then you said, and then
anything
just
to overcome.
Yeah. Right. And then just once I found out, finding a doctor that could actually do the surgery, finding somewhere to even research, if this is where the NET tumor is, who do I go to? What kind of surgeon does that? So I think that was really a challenge, because even though you would go to one doctor, they would say, well, I don't know. So trying to find that trail and researching a lot of it on my own, that was my biggest challenge. And then I think just worrying, because I think once I found the endocrinologist that did diagnose it, he didn't have as much knowledge as some other people do, but he basically called it, this is the 10% tumor. 10% of the time it's malignant, so more than likely it's not going to be malignant, and mine was not. 10% of the time it's outside of the adrenal glands, which mine was outside of the adrenal glands. 10% of the time you pass it on to your children. Well, that's not true. If you have the gene, then it increases. So, just, I think that was a real challenge, just trying to find people that knew information about it.
I guess, similar experience trying to find people who you felt were knowledgeable and could, guide your journey. I've already touched upon a few things, but I think the biggest challenge for me was feeling like you continually had to advocate for yourself, perhaps even more than you should. There were times that I feel that my original healthcare team just was not communicating with me fully. And not answering my questions. After I was diagnosed, I was going to have a dotatate PET scan to get a better idea of, disease burden. We knew it was in my, liver and already from the CT, but just to get a better overall perspective. And like when I met with the physician, he said, okay, we'll get you the scan next week and I'll see you the week after. So in my mind, that's the time frame. And then his nurse reaches out to me and no, the scan's going to be in 6 weeks and I'll see him in 8 weeks. And at this point you're like, what? That's all of a sudden 2 months. And I just felt like they were very dismissive of me and not answering or indicating why it was going to be so long. That's all I wanted to know. So I took it upon myself to try to organize or have a scan at another facility. And I reached out and said that that's what I plan to do. And the nurse was like, no, don't do that. We've already ordered the contrast. That's going to be a waste of money. Like nothing about, I'm sorry you have to wait so long and I understand your frustration, or here's why there's a delay. Nothing to that effect. Just like a one-liner, like, no, we've already ordered the contrast. Don't waste our time. And I was really livid. Eventually I came to find out that it was a supply chain issue, that there apparently was some quality control issue with the agent needed for that PET scan, but nobody ever conveyed that to me. So if somebody would have just told me that unfortunately you hit it right now where, the company who makes this is whatever having issues and we don't have a lot in the chain. So just things of that nature. I was really surprised at how, for lack of a better term, cold and uncaring people are. So I realize if you're in the healthcare industry and you see cancer patients day after day, maybe you're having a bad day. So you try to give people the benefit of the doubt, but I don't think there's any excuse for not communicating to patients and explaining, what's going on. So to me, that's been the biggest challenge, is that I feel like on top of trying to manage my disease, still do my job, still be a mom, still be a wife, that I'm the one that's constantly, checking up on my healthcare team initially to make sure that they're doing what they're supposed to be doing. And so I think for me, that's been unexpected, and the biggest challenge.
Yeah, that's incredibly difficult. And, that kind of does also lead into the next question. And these questions I'll kind of group together. How do you describe neuroendocrine cancer to your friends and family, and how has your diagnosis affected you and your family?
So for me, when I talk about it today, I try not to go into too much detail, but back then when people would ask, so what kind of tumor is this? It's a pheochromocytoma. And back then nobody called it a NET tumor. Nobody described it as a neuroendocrine tumor to me. It was always just pheochromocytoma, and it's very rare. And so I kind of just described it to people as, well, this is like a 10% tumor. 10% of the time it's malignant, 10% of the time it's not in the adrenal gland, 10% of the time. I mean, there were lots of 10% that go along with that. And I just said, it's a very rare tumor that just happens to be there. Not sure why, but that's how I described it. And then you said, how has it affected our family?
Yeah.
For me, I think we've just kind of gone, since I've recovered from surgery, I haven't really thought about it very much, because I haven't been affected anymore until my sister was diagnosed with it. She actually is on the call right now in Mayo Clinic receiving help. So she had breast cancer. She had it reoccur. She had a double mastectomy, had it reoccur. And then when she was having a checkup for that, then they found the tumor. We think we see a tumor, and they thought it was basically the breast cancer that had metastasized. And then they didn't know until they did a biopsy that it was actually a paraganglioma. And so hers has reoccurred the second time. She had surgery, it reoccurred a second time. She had surgery again, and now it's reoccurred a third time. And it has, like Kim, it has metastasized to the liver and to the bone. So she has reached out to Mayo Clinic, and she saw several doctors, one in Vanderbilt and then also at UAB. And, they got the same thought back of, this is the route we think you need to take. And I'm kind of bleeding into your last question. But
That's okay.
The same, they both said, this is the route we think you should take. And, we said, well, should we do the third doctor? Should we go to Mayo Clinic? And, we talked to our dad, and he was like, you don't know what you don't know, and you're not going to know until you go. And so why not go? And we kind of thought, well, we're going to hear the same thing from the other doctor. And we actually went This was in August, and they actually had different things to say. And so, jumping down to your next question that I know you're going to talk about, which is, what
okay.
advice would you give? It is to keep searching for that next doctor and going to the specialist who have more knowledge, because they have other suggestions that other doctors don't have. And they also, the specialists who do this day in and day out, they have more to provide for, whereas at one doctor, they're saying, no, we wouldn't do ablation. Well, then at UAB, yes, we're doing ablation. We're going to do the heat ablation and we're going to do the cold ablation. Surgery is not the option, but we're going to do the radiation, and this is how we're going to do it. So, it has affected us, because once my sister found out that she had it, then Mayo Clinic said, let's do the genetic testing. So she did the genetic testing, I did the genetic testing, and it both came back positive, which now, 20 years later for me, 21 years later, makes me think, okay, so now my children need to be genetic tested. And so that's kind of the route that we're taking at this point. So yeah, and I'll let Kim speak on that. Sorry.
Yeah, no, thank you. Thank you, Shane. Yes. And then Kim, if you want to kind of talk about, how you describe neuroendocrine cancer to friends and family and how it's affected you and your family.
Sure. So I guess similarly, I don't necessarily go into a lot of detail. A lot of people, if you say neuroendocrine, people are like, what the heck is that? So I try to just say they're specialized cells that make hormones. And depending on where they are, they make different hormones. And I think one of the challenging things for this type of cancer, because it is, again, quote unquote, slow growing, everybody is like, well, why aren't you doing chemotherapy? And I'm like, well, for this type of neuroendocrine tumor in the small intestine, chemotherapy is not effective because the cells are growing too slow. And I don't know, people just can't understand. Well, what do you mean you're doing nothing? Okay, you did the surgery, and now if you have more tumors, like, why aren't you going to do something now? Why are you watching and waiting? So I think it does get complicated to try to explain to people. And the other thing that I get a lot of, and I know people mean well, but, well, you look so healthy. You look like you're doing great. You don't look like you have cancer. And I just smile and say thank you. I know people mean well, but it's hard to explain, like, no, I still have stage 4 cancer. This is still a constant journey. And but again, I usually don't go into necessarily a lot of details. How has it affected me and my family? This is where I will get emotional. So for me, it was really challenging. At the time I was diagnosed, thankfully my kids were older, but our kids were 13, 16, and 19 years old, so all teenagers. And I was really sad, thinking that I didn't want them to have to go through this journey. But choosing to do the surgery, I'm trying to be grateful for every day that I do have. I appreciate the message of my surgeon. It sounds maybe trite, but you got to go live life. And that's what I'm trying to do. But I won't deny there are days that are hard. So personally, I think that's the biggest challenge for me. I'm one of those people that are very task oriented. So immediately I went into, here's what we got to do mode. Again, thinking about our kids, we went through all the logistics that I know a lot of people have to do. You got to make sure you have a will. And then we needed a guardian, and we had to create a trust and make sure, in the event that something happened to me, and unfortunately, and my husband, to make sure that all 3 of our children would be cared for. And doing power of attorney and the medical directive. And I think sometimes the thing that you forget, as the patient, you're dealing with a lot, but your spouses are too. And so I know for my husband, it was hard because I switched into, here's what we need to do, and we're just going to get this done. And you forget that, they're dealing with their own journey as well. And so I think that's hard too, knowing that every member in your family has different needs. And so you do the best you can to just kind of keep going. So yeah, I think that's it. You just want to do what you can to be proactive as much as you can, and take it one day at a time. And then that's what I try to do. And some days I'm really good at it. Some days I do forget. I have cancer? Not truly, but you know what I mean? You go on and you go back to your job and you're doing your own thing. But yeah, it's hard. It's hard knowing that, when I was diagnosed, somebody said, you're probably not going to live till you're 60. And then you're like, wow, I'm not going to get to retire. I don't get to be a grandma, all the human things that, makes life worth living. So my apologies if I'm rambling. I get emotional once I start talking about that.
Ah, gosh, I tear up every year. So before I go into some of the more, specific questions, was there anything else that you guys would want to add in terms of giving advice to someone who was recently diagnosed with neuroendocrine cancer? I know you both, Shane and Kim, kind of touched on that, but before I moved forward, I wanted to give either of you the opportunity if you had any advice for someone recently diagnosed. Additional advice.
I would just reiterate that searching for them, searching for doctors and searching for other people who have the knowledge, because and going outside of where you normally would go, just trying to think outside the box to talk to other people, because I didn't even know, still to this day, because it's been so long, that it was considered a neuroendocrine tumor, kind of that umbrella. And I'm not always on Twitter, but that's how I found you, Rachel. And so when I was searching, I was like, oh my goodness, and she's at UAB. And so I told my sister, and so we had started researching and looking even from your link and looking at other people and going, okay, who's knowledgeable? And so that's when we started searching doctors and, just even looking up doctors. And then we would look up reviews of what people had said and trying to find other people's journey of what closely matched, for my sister, who was not newly diagnosed, but newly diagnosed again for the third time, and trying to find that knowledge and trying to find the right match of what to do. So, you have to be your own advocate, like Kim had already mentioned, and that is not just going with the first or the second, but it's really looking deeper and finding people that you can talk to that have knowledge of it.
Can y'all hear me?
Yes. Hi, Jane.
Yes, that's my sister.
Hey, I was trying to. Hey, Rachel. I'm actually coming back from a treatment, day 10. Woohoo! But I was trying to let y'all just share back and forth. Thanks, Kathy. Just got back to the hotel. But if I had to write a book, this is what my book would be titled: Keep On Keeping On.
That's excellent. And yeah, I think that means so much for patients with neuroendocrine cancer, because it's yeah.
I'm jealous of Shane. I'm like, you got the right one. I'm like, good Lord, what did I do? What did I do to deserve this? Especially if y'all saw my list. I was telling the genetics counselors, I said, stop. I don't want to hear any more. And I don't want you to tell me what else I need to be tested for, because I don't want to know, because I've had so many other things going on. But it is true. You just have to keep on keeping on. So,
yeah.
And if I had not kept on and, gone with Mayo, kind of like, when Shane said, Daddy said, well, you don't know what you don't know. I was so thankful for everything that Mayo had to share that nobody else shared. So I'm in the process of experimenting with that now. So anyway.
Yeah, absolutely. That goes back to Kim's point about, the communication between physicians and patients. Kim, did you have anything that you wanted to add in terms of advice?
I think we hit on it. Yeah, it's basically, be your own advocate, learn all you can, and to the point of you don't know what you don't know. You can always seek out second, third, fourth opinions depending on where you're at, and then that just allows you to make your own decisions. You're not committing to anything, but you can then be informed and decide to do what's best for you. No two patients may make the same treatment decision or feel comfortable, coming to the same conclusion, but it at least gives you options. And then the one thing I think I would add that maybe we haven't talked about completely, but groups like this, in that I think it's good for people, particularly with rare types of cancer or any disease for that matter, to reach out and join support groups with people who are going through the same thing or the same journey. It can help to share information about things that people have done or tried. It can be encouraging to know that others have walked before you, and they're still keeping on, because that's really what you have to do. It's like, you don't want to waste the time that you have left constantly thinking about cancer, even though sometimes it feels unavoidable. And so you got to do what you can to just, keep moving forward and seek the treatments at the appropriate time. And try to live life while you're alive, because, you don't want it to be all about the cancer.
Yeah, that's excellent advice. So we have about 5 minutes left, but I do want to ask these final questions for our speakers today, because they mean a lot. And so Shane, I'll start with you, and you've already started to touch on this in bringing up, your family's history and your family's involvement with neuroendocrine cancer. And I was just wondering if there's anything you could add about your family history with neuroendocrine cancer. Does anyone else in your family have any diagnosis, or if you guys want to kind of expand on what you've been going through, especially with, I love that Jamie's on the call, and Raina. You guys are sisters, and no two zebras are the same. You have very different experiences.
Right. I would say we just both received our genetic testing, and we are positive for the SD. Is it SDBH, SDHB gene? Yes. I can't remember. Yes. One of the two, but we were both positive for that. We thought our mother's side, on our mother's side, she would have been positive, because we actually have a cousin on that side who's kind of experiencing some of the same things, and it's with the thyroid, but sweating constantly. And so we thought, okay, it's going to be on this side. She's still trying to figure that out. But our mom's gene did not come back positive. So now, and we just received that word about a week ago. So now we're thinking this is on our dad's side. And I know with that gene, there's, with the genetic counselor that I spoke to, there's also, if people in your family also have kidney cancer, there's the von Hippel-Lindau syndrome that could come with this. And so mine was negative for that. Jamie's was negative for that. But we do have on my dad's side, he's the oldest of 6. We do have 2, an aunt and an uncle who both had kidney cancer. One passed away from it. So we're thinking this gene might be on my dad's side. And then one of the uncles that had the kidney cancer, his son has just, he's going to go through some genetic testing as well, because he does have a cyst on his liver right now. Jamie just told me that like yesterday or the day before. So kind of looking into that side of the family to see, because there's a lot of cousins, and then a lot of their children as well, that this could be possible for them down the road, and just keeping check on that. So scans to make sure everybody is okay. I know everybody doesn't want to have that test to know if something could be there later on, but you never know. I think knowledge is important because you can keep check on that. I think if I had known early on, at least when I had the symptom of sweating, I would have been like, oh, I need to go to the doctor because this is what it's for. So knowledge is power. And, at least even if they don't have genetic testing, just to know some of these symptoms that are in the family, so people are aware and they have it in the back of their mind to go and get checked if something comes up. And to be able to tell a doctor too, for those doctors who might not know, say, look, this was in my family. I think that's important. So.
Absolutely. So I do want to get to Kim on a last question. I wanted you to kind of talk about how being a cancer biologist has affected your experience of also being diagnosed with cancer. If you could kind of touch on that topic of you study it in the lab and then you're also diagnosed with it.
Yeah, so I guess, I mean, it's back to the knowledge is power. So I was glad that I was able to do my own research and feel informed about decisions. And by all means, everybody can make informed decisions without being in cancer biology. But I think for me, I viewed it as a benefit. For me, when I was asking questions, it made me realize my first oncologist really wasn't up to date on the literature and kind of consensus guidelines. And so it was then eye-opening to realize that, okay, this is somebody who is not necessarily going to indicate that they don't really see that many NET patients, but rather, I don't know, at times it felt like it was like, I'm the doctor, here's what I recommend, watch and wait is fine for you. And, most patients are happy to hear that they're not having surgery. And it was like he was getting mad at me for asking questions. And I was polite, I was respectful, I was just information seeking. And that was a big clue to me that, okay, this is not the right physician for me. He's not answering my questions. And I truly don't feel like he's informed. So I am not going to stay with this physician. So I feel like that helped me then seek out somebody who does answer my questions. So I think it's back to communication, that anybody, regardless of your background, if you're not happy with your healthcare team, even though it's exhausting with everything else, it's worth the effort to go find somebody else who will feel like they're answering your questions and is on your team.
Absolutely. All right. Well, that puts us at about 1 o'clock. And so I just want to say thank you so much to Shane and Kim for participating today and be willing to share your experience with all of us. I know that I tear up every year, and this is always my reset of why we do what we do in studying and why this foundation exists. So again, thank you to Shane and Kim. Thank you, Jamie, for tuning in. And thank you to everyone from tuning in and listening today. So this was a great event. And Selena, is there anything you'd like to add before we end?
Just to reiterate the thanks. Inspirational, all three of you. And I wish you well on your journeys, Jamie and Kim. And Shane, really pleased for you that you are clear. I mean, it's just amazing. But really good luck, Kim, and really good luck, Jamie. Just positive thinking, and definitely. And yeah, you made me cry, Kim. I'm sorry. But so anyway, this is our last one for 2023. So happy Thanksgiving, happy Christmas, happy New Year. And we will hopefully see you all again. Our next one is Thursday, January the 25th, 6 p.m, where we will have a speaker to be announced. So yeah, thank you very much, everyone. Thanks again. And thank you, Rachel, for hosting. Thank you for your questions. They were amazing. So thanks again. And we'll see you all in the new year.
If I can add something, thank you, patients.
Yes.
So for us scientists, it makes really important that we are not working just on the cell lines, but we have a goal, seeing patients and hearing your stories. So, and being a mother, also wife and daughter of cancer patients. So it's really encouraging and really keeps us going to this research. Thank you for your stories. And please reach us, because we are searching for new treatments when we are studying. So if you have any questions, any ideas, or anything what you want to try, please let us know.
Absolutely. All right. Goodbye, everyone.
Thank you.
Bye, everyone.
Thanks.
Thank you.
Bye.
Bye. Happy New Year.
Happy New Year.